I'm Dr. George Flynn, and you're watching In-Depth TV. Today, I have got an interesting topic and an interesting person that has plenty of experience with GYN and OB. Lea Bannister has been a friend of mine for years, and she understands everything going on in the field of OB/GYN. And today, we're going to talk about something you've probably heard about, but it may have fallen out of favor, the Pap smear. What's your idea on it? Is it still in vogue? Are people still getting these? Or does it help? Does it hurt? How does it work?
It's still a very critical part of women's health care.
It is?
It is.
And what is involved in a Pap smear? We've all heard about it. And we all have, in medical school, we all saw the stains and everything. How is it performed? Because we just need to know, some people are afraid of these things.
Very true. The collection process has not changed a lot. That's make an appointment with your healthcare provider. The use of the speculum, the device to open the vaginal wall so that we can see the cervix, the opening to the uterus. And then we use usually one or two little devices that are flexible, soft, but they are going to be rubbed across the cervix, slightly inserted in the cervix to collect cells.
Okay, and once you collect the cells, is that a painful procedure?
For most, not. Now, some are not relaxed. Some women may have hormonal changes or anatomical changes that make it more uncomfortable. But for most, it's not painful.
Not painful. And so what does the Pap smear detect? I mean, does it detect any kind of cancer in the body, or is it specific to one type?
It is primarily screening for cell change of cervical cells.
Okay.
Now, it can be used for the upper vagina or vaginal cuff after women have had hysterectomy. And there's also this important addition of molecular technology of co-testing at the right age for the HPV.
Well, you've opened up a whole new topic here. Cervical cancer, first of all, is it on the rise? Is it on the decrease? Are we catching it earlier with the Pap smear? How is that working out?
Well, it depends where you're talking, but I'd say in the United States, detection has gotten earlier stage and better outcomes. As far as being on the rise, the incidence, I don't know, has changed much in the last 50 years.
But earlier detection, are we getting better outcomes? We getting better cures?
Oh, they are.
Okay.
Yes.
And say someone comes out with a positive Pap smear. What is the first treatment? Is it all of a sudden you go into major surgery for this, or is it something more minor that you can treat this?
Right. An abnormal Pap smear is a fairly common event in a woman's life, and the majority of it is going to require discussion with the healthcare provider, maybe repeat testing, maybe a little bit more diagnostic evaluation with a microscopic exam of the cervix and some tissue sampling. The majority are not going to need major surgery.
Okay. What is the thing? Is there still a thing called the cold knife cone or the leap or what?
The leap is kind of the
what
primary
is that?
thing.
What is that? Because we've heard of it, but people have read about it. But that's why we're In-Depth TV. We can explain in depth about this.
The leap is a procedure to treat cervical dysplasia of a high-grade nature.
So that's you're saying the cervix, the cells start out, they get a little bit abnormal, then more abnormal, then really bad dysplastic, and then turn into cancer.
Right.
So we're treating a precancerous condition.
Precancerous, but the level of severity that you do want to treat. And the LEAP is an instrument that allows us in the office with a little bit of local anesthetic sometimes to excise a wider area of the cervix where that lesion or abnormal cell change is taking place. It's a quick procedure, should have very little discomfort with it, and the recovery doesn't change your activities very much with good outcome.
Okay, so you take out that area that's abnormal and then you just follow it. You watch it every 3 or 4 months. Then with a Pap smear.
It depends on the abnormality, but and with other testing, the follow-up is important for a couple of years, and it varies with your healthcare provider. It may be between 3 months to 6 months to an annual basis.
Okay, so you get that. So we've got cervical cancer. And by the way, what do we have any reasoning, any causes, any things that people can do to help prevent the incidence of or help lessen the incidence of cervical cancer in
yes.
there? What can they do?
There is a vaccination. It's for human papilloma
HPV.
virus, HPV, and it is available for our children, starting as early as age 8 or 9, and can be given at any point after that. Ideally, the individual is getting that opportunity to be vaccinated before they're ever sexually active.
Okay, so you get the vaccination, you develop antibodies to the HPV, and then so if you're ever exposed to it, your body is able to.
Much less likely. It's not 100%
Right.
because HPV is a virus of many, many different subtypes, but it does offer a large umbrella of protection.
Okay, so when you get the vaccination for HPV, are there any other factors, by the way? Smoking or
Smoking probably has some increased risk to development of cervical cancer, yes.
Okay. Any other things?
Number of
STDs.
sexual partners,
Okay.
unprotected sex, yes.
Okay, so
Those are-
anything that irritates the cervix, a virus or a
Correct.
bacteria or anything, can cause the cells to get
Transform,
Okay.
yes.
So we're looking for stabilization of the cells, basically, and keeping them. So HPV, let's talk about the vaccination. Some people that I've heard of and I've talked to are extremely anti-vaccination. Some people are
They are.
extremely pro. What is your professional opinion about vaccination? Of HPV. We won't go into smallpox and everything else.
All
We
the
won't-
other early childhood vaccines. It is a safe vaccine. It's based on technology and our body's response that's been studied
Okay.
for 50, 60 years.
Okay. So,
It's not new technology. It's just that we're now have a target for that specific virus.
now I'm getting ready to use some big words here, so
Okay.
I love the big words. Is this a live virus or an attenuated virus or a killed virus?
It's
How about that? You didn't think I'd know
Yeah, that's good. It's a killed virus.
those. So
You're
it's
not going to get the infection.
so it's a dead virus,
Right.
and you're just getting the parts of it
The
that the body
particles
can.
of the virus, so your body will make an immune response.
Okay, and
Build the antibodies.
for those of us or. Well, wait a minute, we got to get into another topic here. We just opened one up. For those that are interested in getting one, is it 1, 2, 3 shots? Is it a series? What is
It's
the
a
HPV?
series. It's 3 injections.
Mm-hmm.
They shouldn't be given any closer than 2-month intervals, and ideally you finish it all in 6 months. But that doesn't always happen, and it appears that you can pick up where maybe you were gone at school, and it's been a year since you had your last vaccine. You can do number 2 and then come back shortly after
get number
that
3.
and do number 3. Yeah,
Okay.
you have a good amount of time to get that in.
Now, I realize you're an OBGYN, but I also realize you know a lot about HPV and the vaccinations. What about men?
Yes, men gain protection.
They
do.
should get it?
They should. They do lower their personal health risk. They also help to lower our risk to their female partners.
See, man, I knew we weren't going to get off scot-free on
No,
this.
not on this one.
So we're not getting.
You're
we're not,
still running free on the birth control.
on the birth
to
control,
the
we're
degree.
okay, but not on the HPV.
No.
Where would men get this? Do they go to their OBGYN, or who do they go to? Where would they go to get it?
Ideally, the discussion and the decision process is being done as early when they're still seeing pediatricians or maybe a family physician.
So young children can get this
Ideally.
as a male or a female.
Correct. And ideally, they're, being introduced to them and their parents when they're still at home and before they've ever thought of sex.
Okay, so they just know it's another vaccination.
The child probably in those situations, correct. But the
Okay.
parents are making the informed decision.
All right, and how do you, if a parent comes in and says, I don't know about vaccinating my child, is this just a, me saying okay to have sex kind of thing? How do you answer that?
Well, you explain to them that no, it's not giving them permission to have sex, that that is something that y'all hopefully have talked about, takes place at a later time under different circumstances, but it's like putting on your suit of protection before that process ever happens.
Okay.
Because your body's going to develop these antibodies and be ready. So it doesn't have to be linked with you got the shot, go have sex.
How do you know, say somebody comes in to see you and they're in their 20s or 30s, how do you know if they have HPV already or not?
Well,
is there a blood test or any kind of test to know if you have HPV?
There are sometimes physical consequences, the genital wart, skin changes.
Okay.
Other times it can be detected by the molecular technology, that testing done typically with a Pap smear. It's not necessary to look for that infection, though, in the younger population, just because the immune system does clear most of the trouble then. It is important when you're 30 and older, though.
If you already have it, is there any sense in getting vaccinated?
We still tell you there could be potential benefit.
Oh,
Because there are so many subtypes of the virus.
Okay.
So
All
we
right.
don't know what infection you may have. This
Can
vaccine may
protect you
still
against another
protect
one.
you.
So if you have one, it doesn't mean you're immune from having the rest of them.
It doesn't.
Okay. All right. And there's so many different types of this virus.
Subtypes of the virus. They
Okay.
number them.
Oh, they do. Okay. And the HPV vaccination, do we have any idea? Is it a broad spectrum vaccination, or does it go?
It targets about 12 subtypes of the virus. Tries to pick up the two most important high-risk subtypes that are associated with cancer.
No, I hope you
And then
understood
others.
what she just said. It helps protect you against the high-risk virus. Now, the other ones that are annoyance, it may not protect you so much.
It will give some protection
It does.
to some of the low risk. Yes, it does.
Okay.
It
So,
does.
and what we've been talking about is cervical cancer, and the detection of it, and the treatment for it, and how to prevent it.
Right.
If you have a cervical cancer, a patient comes in and has diagnosed with cervical cancer, what is the treatment for that? And it's not I don't think, in what I've seen, it hasn't been a death sentence.
No, it's
Cervical
not.
cancer,
No.
if it's if it's there, is it hysterectomy? Is it what
It
is
may, in general, it's usually a hysterectomy, yes. And then there may be radiation needs or chemo needs dependent. If it's detected, the patient will be referred to a GYN oncology specialist, and they will then coordinate their care.
Well, the main thing is early detection.
Oh, so important.
So how often should someone get a Pap smear?
That has changed probably in
figured
the
it
last
had,
10
yeah.
years. It is typically a process that should happen no less than every 3 years.
Okay. So,
Whether your doctor tests you more or you want to be tested more is a discussion to have with your healthcare provider.
well, that is, I think we've covered this topic very well, answered a lot of questions, and I just want to thank you for being
Well,
here.
thank
and
you for having me.
And we're going to put your number at the bottom of the screen in case anybody wants to call you with some more questions, but I really appreciate it.
Thank
you
you.
very much.
Thank you.
I'm Dr. George Flynn, my guest, Dr. Lea Bannister. Thank you for watching. We'll see you next time.